space in the hospitals. We have physicians who are doing nothing, who are not working directly in the hospital, who want to be seeing patients again. So even in my sector, there's a lot of concern about, hey, can we begin to start reopening things if we move ahead with caution? My take on this whole thing is, obviously, we can't stay in a lockdown state forever. It's, maybe good for our public health, but it's not good for, clearly, economic health. It's not good for emotional health. So, at some point we need to strike some compromise. I just think we have to move very carefully. And one concern I have is that on the task force that the governor has put together, there are no people from public health. There's no people from the health industry. So that's a major concern. Hopefully they will move ahead responsibly. There's an interesting study that came out last week from, there's researchers from MIT, along with a couple of directors from the Federal Reserve Bank. And they actually took a look at the 1918 Spanish flu, and they studied this extensively over a 5-year period afterwards. And they found that those communities in the United States that took the most responsible long-term social distancing actually had the best economic forecast in the long run. So just something to think of. We're not comparing apples to apples necessarily, but there's a lot of moving parts here. And I think this is going to be a big issue as we begin to just get this sense of complacency. A few other things, on that issue, I mentioned there was a Quinnipiac University poll that was released earlier today, and they showed that 72% of Florida voters say they do not want social distancing rules eased before May, and 76% of voters say they don't want the state's economy opened until public health officials deem it safe to do so. So I hope that a public opinion continues on that level. We continue to put pressure on our leaders so that things are done responsibly. A couple other things to note in the search for, and again, so many of these things have political issues, the people taking one side or the other on it, when they should really be kind of scientific health issues. We look at treatment. The one thing out there we've heard a lot about is the antimalarials, the Plaquenil. And a few weeks ago, people were touting this, that there was a study from China about how people did really well. And just in the last week, there have been a couple of sizable studies suggesting that maybe this doesn't work at all. There was a study from France that said it didn't make any difference. There was another study that came out of the University of Virginia in cooperation with the NIH, National Institute of Health, yesterday. They looked at about 400 patients. They said the ones who were put on the antimalarial regime actually did worse. I think what this just speaks to is we can't jump to rapid conclusions. We're desperate, we want treatments, and something works, but I think you have to work with your trusted physicians if and when you are a patient who they're going to be treating. In time, we will know, but again, I hate it when I see the politicians and the legislators telling us how to practice medicine. So we really need to be patient to see what's going on here. A couple other things. Each of the specialties is looking for a connection to COVID, since there's so much of this going on in the news, at least. Among the ear, nose, and throat physicians, they recently came out and saying a couple of things you have to look for that might correlate with having a diagnosis, is one of them being anosmia, which is a difficulty or inability to smell things. And another one is called dysgeusia. I had to look this one up. That actually is an altered or loss of taste. So that's what the ear, nose, and throat guys are looking at. And my specialty was dermatology. In the last day or two, there's been a lot of items in the news about, are there certain skin things that show up in advance of the COVID disease that could be early warning signs that a person might be infected with that. And I'm not so sure how common this is. I have not seen this myself. I'm sure we're going to get a lot of phone calls on this. Approximately 20% of patients who have COVID apparently have some skin rashes of some sort. And most of them are not particularly specific for COVID. They're red rashes, they're hives. Some people have had chicken pox-like lesions on their bodies. One of the things that has been out there in the last day or two is something called COVID toes. And it's people, particularly they've seen this in younger in teenagers and in children, apparently, where possibly even a day or two before they develop some of the respiratory symptoms, they showed something that looked like a frostbite on their toes or sometimes on the fingers, where they're kind of like purplish and red, due perhaps to some immune response where it's blocking the circulation or something along those lines. So COVID toes, that's the one that the dermatologists are claiming. At any rate, it's just, again, putting a lot of data together quickly. What's interesting is, we have the technology now with the internet and social networking, et cetera, where we can accumulate data in a hurry. So I think this is a really positive thing. Of course, we're probably at some point inundated with a little too much data, but that's kind of what's new out there. So that should bring us up to date. And now, Ken, we'll move on to the special guest tonight, where we're going to hear about scams, COVID scams.
Not quite yet. I've got a question.
Okay.
Question in the queue from you, from the awesome Kathy Smith, and she's I see you smiling, Kathy. She's wondering, how can we get involved in becoming a corona investigator? I think they call those contact tracing person.
Yeah, that's a great question. That kind of dovetails with the whole point about, as we begin to lift the restrictions, which we have to do at some point. The way to do it responsibly is with increased testing, and we can do a whole hour just talking about testing, and contact tracing, which means you find an individual who tests positive, and then you have to do an extensive history to find out who these individuals have been in contact with, and they have to be tested. Those people test positive, they have to be isolated. So it is a bit of a complicated process. I will mention to you that the Palm Beach County Medical Society right now is working with the health department, Palm Beach County Health Department, to possibly develop a special education program. We already have what's called a Care Coordinators Program. We're seeing if we can't tie it in with that, so we can specifically train people who can be part of this contact tracing. So if you contact the Medical Society and tell them that I sent you, that would be a great starting point for this.
And while you were talking, I put up the information about the testing locations for the viewers in case they needed phone numbers and stuff. And I noticed, with the exception of two sites, the 15 as well as South County, require that you have to be symptomatic, while Belle Glade says there's no requirement to be symptomatic.
And there's something new that just came out in the last day or so. LabCorp now has a test that they will send to your home, and you go online and you sign up for this, and you do your own swabbing, and then you put it in a box and you FedEx it back to LabCorp. So that was just approved by the FDA. They gave them emergency authorization. The drawback there is they only have 60,000 tests available, but that's just this week. So it's called Pixel by LabCorp. So that's going to be something interesting. And that's also supposedly only open to people who have symptoms or who've been in contact with someone with symptoms. But how it works, and I tried it today, you go online and they ask you the question. So if you want the test, you'll figure out how you have to answer the question. And then they have supposedly a doctor there who looks over your answers and decides if they're going to send you a test. And the turnaround time apparently is you can get the results in about 2 or 3 days, they're saying. Okay, and there is that one they're charging $119 for, I see. But it's also something that's probably reimbursed by insurance. But that's the latest one that came out. And there's going to be a whole bunch of other tests coming out on the market in the not too distant future.
Okay. One of the commenters said the home test costs $200, so I'm sure there's some fluctuation in there somewhere, and whether or not insurance will cover it. So we're not going to debate what the cost is, but apparently it's a pretty significant sum for many of our county residents.
Oh, absolutely. Yes, it's a work in progress. So hopefully that will resolve itself to some point. But I think in the not too distant future, hopefully we'll have readily available, inexpensive testing for people. And people are going to need to repeat the testing, because if you're negative today, that doesn't mean that tomorrow or next week you're not going to be positive. So a negative test is just measuring this point in time.
Okay. One other question here, and you started going over the statistics early in your briefing, but what were the total cases in Palm Beach County again? And I know our numbers here in South County in the Boca area have been pretty high. If you happen to have that number, I think that would satisfy the questioner.
I don't know if I wrote that one down. I know in the state of Florida, we have 28,000 cases. And South Florida is something like a third or half of those cases.
Okay.
I can look that up and get that for you in a few minutes.
Okay. And as we transition to our, let's see, we're supposed to be free. One comment here was they thought testing was supposed to be free. I think there's a difference between what the state offered testing is versus the ones that you order at home, and the insurance company will cover that. One statistic.
And I'm going to say it's a great segue as we get into the scams, because there's a lot of testing scams out there. Yeah. So that probably should be the first topic that we hear about.
Okay. So next we'll go to Harold, and I've given you a brief. I hear a wait. Harold.
Thank you, Ken. Thank you, Ken. We all have seen tragedies and other disasters occur, and we see the best of people when these tragedies happen, and unfortunately, we also see the worst in people, and that's basically what I'm going to address. There are really dozens of scams and frauds occurring daily, and I'd like to share just a few examples with you. First, no one from the government will ever call or email and ask for personal information, such as your social security number, credit card numbers. They don't need to confirm your birth date. Anyone telling you that they're required to collect that information is so that they can get your personal information or get money from you. And certainly there are scams that we'll talk about where people are trying to charge a fee for getting your relief check. There are no fees. And if anyone calls and they're making an offer and they want payment in gift cards, that should certainly be a sign that somebody's trying to scam you. And we have to really be aware of that. Typically, older adults are targeted by scammers because they often have more wealth. But recent research by AARP shows that all age groups are vulnerable to scam attempts. That's because the shelter-in-place rules are keeping more people at home, where they're more likely to pay attention to what they feel are urgent messages. We suggest really that you verify or contact the sources through other means. At the end of my comments, Ken will show some resource contacts where you can get questions answered as to whether you're dealing with a scam or not. For example, you may get a text on your phone, and purportedly it's from the IRS, and your economic relief check is ready. They're getting ready to mail it to you, pending your acceptance. there's just a form to fill out with personal information. Please do not click on these links. Do not click on these attachments. They're attempts at scams to get your personal information, and you really have to be skeptical. The concern over the coronavirus has resulted in scammers using robocalls to lure people into becoming victims of a wide variety of coronavirus-related scams, such as phony testing kits, work from home jobs, a wide variety of cures and treatments. And there are warnings that are continually going out against these scams, but unfortunately, the scammers are able to get money and personal information from their victims. Dr. Schillinger mentioned the at-home test through LabCorp, and the Federal Drug Administration is reporting that they're seeing a spike in people selling COVID-19 self-testing at home, and it's up to the consumers, to us, to make sure that we do our homework before we let loose of our money. COVID-19 testing at this point is being conducted by medical professionals. Any test kits that you see online that are being sold directly to consumers, you really have to make sure that they're legitimate. The phony kits cost you more than money. They can result in patients delaying necessary medical care or treatment, and we have to be very cautious in what we're doing. The temptation of having the peace of mind provided by at-home testing is understandable, but at this point, until we really get some legitimate tests out there, it's too good to be true. There are scams regarding calls being made, people posing as employees of the Department of Health and Human Services or similar government agencies, and they're sending out texts and emails asking you to click on a link in order to take a, quote, required, end of quote, online test or register for COVID-19 testing. This is a fraud. They're looking to steal your financial and medical information. A classic phone con has been updated, very similar to what we've been experiencing over the last few years on grandparent scams, ransomware scams. A con artist will call and ask for a wire transfer to pay for a relative's urgent medical care. Now we're seeing reports of phone calls that look like they're coming from a medical or a government official saying that a loved one is being treated for COVID-19 in the hospital and needs someone to pay for their medical care immediately. They're asking for wire transfers and even gift cards. When you get those kind of calls, hang up. Please don't get caught up in these types of scams. There are fraudulent offers of travel insurance. People calling and saying that they're peddling travel insurance that specifically covers COVID-19 related problems with future travel. The majority of travel agencies and insurance companies do not cover pandemics, though some legitimate providers have extended coverage to coronavirus related cancellations. If this applies to you, go to the people that you have been doing business with, and certainly don't respond to pop-up ads or phone solicitors. The problem with fake charities, it's always an issue. Ken, I think you were almost too kind in putting a name to these shady characters, but con artists can use platforms like GoFundMe to fool donors, steal the money for personal use. Before you donate to a charity, make sure you do your research before you donate to any person or cause. Just because there's an appealing photo or a heart-wrenching tale of need doesn't mean that the campaign is legitimate. Emotional images and appeals are common because they work. Try to give only to individual organizations you know and trust. Don't include any personal information. And it may sound obvious, but take extra caution if a charity is insisting that you act fast, especially if they request payment from debit card, prepaid debit cards, or gift cards. And just as a side note, a charity is legitimate as long as they donate at least 1% of what they collect for charitable purposes. So if you donate $100 and the administration and telemarketing fees amount to $99, suggest that you think twice. And the Securities and Exchange Commission is reporting a rise in investment fraud, offering false inside information about companies working on vaccines or cures. Please don't entertain any offers asking you to send money right away for a once-in-a-lifetime investment in companies manufacturing tests, vaccines, or other medical appointment.
Hey, so Harold, if I could interrupt you a second.
Go ahead.
So you've listed out quite a few of the things that we need to be on the lookout for. But I'm sure everybody on here firmly believe that we are way too smart to fall victim of any of these cons and scams. Yet, those numbers are pretty high. Florida ranks #1 in a lot of frauds as well as identity theft. So what is it about these guys that make them so successful that we have to be on our guard? How do they get past all of our protection that we already have around us? Because we're a smart bunch of people.
Well, you make a valid comment, but who is it, Willie Sutton? I don't know how many of people on this site will remember the name, but Willie Sutton was asked, well, why do you rob banks? And his response was, because that's where the money is. So these people are professional. They know what they're doing. They're well trained. It's tax-free income. They may be using disposable cell phones. They may be calling from out of the country. They can certainly arrange to make it look like they're calling from next door or from government agencies. They can be calling from Uzbekistan or Jamaica, but they can show a 561 area code on the caller ID. And they truly know what they're doing. So that many people feel that just because they've signed up for the do not call list, that means that they won't get any calls from illegitimate companies. Well, the do not call list, it's off the point, but the do not call list is provided for businesses, legitimate businesses, who will willingly say okay, if you tell me you don't want me to call, I won't call. That's for legitimate businesses. The scammers, they ignore the do not call list. They certainly won't pay any attention to it because it's too difficult to catch them all too often. But if you get calls from unknown numbers, or even if it's from a number that appears to be local, many people choose not to answer the phone and basically wait to see what the call message is on whether they're going to call back or not. But if somebody's initiating a call to you, please don't share personal information and be extremely careful so that if somebody calls and indicates, and I know I've gotten them at home, and many of you have, your oldest grandchild is in the hospital, and in order to save their leg, we need money, and we need you to wire transfer it immediately. And there isn't a day that goes by that these scams are not perpetrated here in Southern Florida. And it goes on and on. Be aware that the scammers, they can use the caller ID to make it impossible for you to detect who's calling. But if you get any correspondence via email or mail from any government agency, it's very easy for these scammers to adjust the address. And all government agencies end in .gov, but many of these scammers will use .gov, .net, or .com. Do your homework. And Ken, you've got some information on the slide, hopefully, that can provide some email addresses and phone numbers for people that may have questions on whether they're involved with a scam, or even if they have been involved with a scam. It's a resource to go. Generally, you're not going to get your money back, but certainly you can report it. I should note that in Southern Florida, the estimate, depending on which law enforcement agency you're talking to, they estimate that 70% of senior citizens will not report being a victim of fraud because they're embarrassed. They're embarrassed for their family. They're embarrassed for their friends, and they don't want to admit it. So we really have to be very cautious. And I encourage everybody that's on this, and also encourage you to look after your neighbors, look after your family. If you see somebody getting into trouble financially, or that they might be getting involved with a scam, tell them that there are places to call. You can call your local police department, your local sheriff's office, and the numbers that are posted on the screen. But unfortunately, the scams continue. By the way, Dr. Schillinger, your presentation was excellent. Really, I commend you for it. It was good information.
And I'm enjoying yours as well.
Thank you.
So
That's it, Ken, unless anybody has any questions for me.
I put up some additional ones. Can you hear me okay?
Yes.
Okay, I put up some additional ones that came in an email to me today. Scams like fake service calls where they're offering to send you goods, cleaning supplies. One big one I've been hearing about lately was when they mandated that we all wear masks, no one could find masks. So you go online looking for a mask to order, and they'll gladly take your money, but they never ship it. And like you said, like your false charities and fundraisers, the door-to-door sales, folks helping you with your relief check, helping you get that faster, or managing that for you. There's no end to the ways that they want to help us by taking money from us, and we never derive any benefit from it. Are you aware of anything that's really popular here in Palm Beach County right now?
as far as the scams, I think that really they're pervasive throughout the country. Unfortunately, ongoing, as you mentioned, Florida, especially Southern Florida, is a prime market to basically provide scammers with money that they steal from people and also personal information. The cost of robocalls, I was reading an article yesterday where the cost of placing a robocall used to be approximately 99 cents. Now it's down to approximately 1 cent. So the scammers are calling and they don't even know who they're calling. They're calling cold. The numbers are being dialed automatically, 1234, 1235, 1236. And people say, well, how did they get my number? Well, they're not even trying. They're just automatically dialing all of these numbers. And we have to learn to be skeptical, whether it's somebody calling for a charity or somebody trying to sell you something that sounds too good to be true, because quite often that's just what it is. It's too good to be true. Too good to be true.
Yeah. So before I open up the unmute everybody for questions, I just wanted to share a little personal information. My mother-in-law, wonderful lady, probably charitable to the fault. I had to convince her what you're just talking about right now. If you don't recognize the phone number, don't answer it. Because even though it may look local, it could be some of these scammers using the robocall feature, waiting to get someone to pick up the phone to say hello. And the fact that many of us think that if I recognize it's a scammer, I'm going to hang up on them. We've already done some part of the damage already, because one of the purposes of robocalling is to find out if that's a legitimate number and will you reach a live person. And if you answer that phone, there's already a value attached to that, and they sell your phone number now on the dark web for pennies, yes, but your number gets circulated over and over to all of these scammers merely because you answered the phone one time. So now they just come back with different methods. Maybe it's the grandparent scam. And they did try that on my mother-in-law, the grandparent scam. She thought it was my son, and he was in trouble and he needed money. Fortunately, it's a blessing and a curse, mind you. She's on a fixed income, and when they asked for an amount more than her finances could accommodate, she told them, you need to call your daddy, because they wanted too much money. So
Good point.
yeah, so I just said we're all smart people, but little things we do just create opportunities for us to become victims. And not answering those unknown numbers is really a smart thing to do. And gee whiz, I know with AARP, some of our folks on the line tonight are members of AARP, and in their April bulletin, they had a whole feature on fraud and scams and the worldwide impact of all of these folks willing to separate you from your hard-earned money. So
I should add, Kit, if I may, on the information you posted, especially for AARP on the Fraud Information Center, anybody can call. One doesn't have to be a member of AARP to get help. If you have concerns, questions, by all means, feel free to call that toll-free number.
So I had a question, Harold. How do these scammers, they may be calling from someplace in Asia, but the call comes in with a Delray Beach number, and it says that right on your phone. So you think, oh, maybe this is somebody who I know.
Well, they have the ability to do that, and they call that, all of these scams now have names, and the name on that one is spoofing. So there are people who will get calls, whether it be from Fake Charities or whether it be we're going to shut off your power because you haven't paid your bill or you haven't paid for parking tickets. We're sending somebody over with a warrant for your address. They can show that they're calling from FPL, from PBSO, the sheriff's office. They can show whatever numbers they want. They have that ability. And one would say, well, why doesn't somebody do something to stop them? Go find them. Where are they? Like I said, they could be calling from Europe, Asia, the Caribbean, or next door. And if they're calling from a disposable phone, you just can't find them.
So I'm going to unmute now, but just gee whiz information. I love sharing. My wife and I were sitting at home one Saturday evening and my cell phone rang. I looked at it to see who was calling me and my picture pops up on my cell phone because they spoofed my number and they're calling me from a spoofed number saying it's me. So the question is, should I answer that? But you know the answer.
Did you?
It's the call today that my computer has been hacked. That's a big one right there. Someone got a call say, I think that's the Microsoft scam where they want to repair yours. And there's no way in the world they can tell remotely that your computer was hacked or invaded, and they wouldn't call you. There's no way to connect those two dots to call you up directly. So I'm glad that they said this person didn't say they also fell for it. One questioner here says their phone says scam call. So obviously, Catherine, not whoever that is, you have one of those applications on your phone that tries to compare the number that's coming in with a database. And if it finds that number in that scam database, it will often say, if it doesn't cut it off automatically, it'll tell you scam call. I see that label pop up on some of mine already. I'm just trying to get these on the table. Is there nothing?
I might mention some phone companies will provide that service at no fee. And then there are other services where you can buy the program for a fee. And it will filter out some of the calls, but certainly not all of them.
Yeah, there's a couple of them called like No More Robo. No More Robo is
yes.
One. It's free, but you can buy a premium service. And so that sort of answers your question, Mary Jane, about some of the things the phone companies are doing, but they also are supposed to be unveiling a new feature later this year that they've all come to agreement to do, where they're validating the credentials of every call that's made to make sure it's a legitimate number before they connect it up with the destination that number is calling. So that's supposed to help us some as well.
I think there's a lot of built-in things. You know, I had to get a new phone recently after I dropped my phone for the last time and cracked beyond repair. And in this new iPhone 11, must be something in the software, because now I'll get these calls and it says probably scam call. So I think that is part of the new software. I wanted to ask Harold something else on the COVID scam specifically. There was something in the news today that apparently not only does it happen on a consumer level, but apparently the state of Florida, there's a guy, did you see that article? There's a guy from Shark Tank whose name was Damon John. Apparently he was trying to cook a deal through the governor's office, dealing with the governor directly to sell them masks, COVID masks, when we had a shortage a couple of weeks ago. And they actually apparently were supposed to signing a deal for $7 million for 1 million masks, which was about 5 times over the market value. Did you see that article? I'm just bringing that up because apparently you can be scammed on a lot of levels.
I didn't see that one, but I received an email, and I can't name the agency,
I
but
don't know whether
volun-
to,
a volunteer with a with a legitimate agency was personally selling N95 masks for absolutely outrageous prices. And I basically took that email and forwarded it on to people who hopefully will do something about it. But the people are coming out from under the rocks, and they are lowlifes, they are thieves, they're trying to steal, and I basically cannot come up with any kind words for these people. They're absolutely creatures that shouldn't be allowed to do what they're doing.
You've absolutely topped my ne'er-do-well, so I won't even try to compete against you there. But folks, your phones are unmuted. Do you have any questions for Dr. Schillinger or Mr. Moldoff?
Oh, yes, I had a question.
Yes, Rebecca, go ahead.
Yeah, I was just going to ask, what role does law enforcement play in these scams? Are they taking an active role?
I'm not a lawyer, but the legal answer would be it depends. If somebody receives a call or an email and it's attempted fraud, and they call their local police department or the local sheriff's office and want to file a complaint, they may take the complaint, but quite frankly, they won't do anything about it because they can't. It's out of their territory, and all they can do is basically put it on record. And generally what happens is it will normally go to ftc.gov, which is the Federal Trade Commission, and they'll basically put it on record. If the total amount of the crime, and not too many people will admit to this, but if it's under $30,000 in totality, they're not going to do anything with it. If it gets over that, if they can find the perpetrator, they will. But all too often, in reporting these crimes to local police, there's nothing they can do. All they can do is just put it on a report.
Okay. There's just no way to track it or do anything. Okay.
And they don't have, quite frankly, Rebecca, they don't have the personnel to do that. Because, at what point do they stop? What point do they start?
Right. Okay.
Sally has a question. Go ahead, Sally.
I think this question would be for Dr. Schillinger. I live in Boca Lago. A neighbor was driving through one of our pods and stopped to say hello to a man and his daughter. They were in their car. The daughter and the man were walking, and the daughter said, "Don't come close. My father tested positive for COVID." Neither were wearing masks. The couple went home, called the CDC, called the sheriff. Nobody would do anything. What can we do in a situation like that?
Well, how close was the contact?
Well, they were in the car, so it wasn't that close, and the daughter stood away. But here they are walking in the light of day with no protection or anything, and he's tested positive already.
Well, I think, first of all, in terms of contagiousness, okay, even without a mask, if you're at a distance from them, it's unlikely that you're going to catch something unless they sneezed and they wiped it on some surface and then you went over and touched that surface. So it would probably be kind of remote. Certainly if you were at a distance. You tell me, it was a bit of a distance. So I don't know that they would be in violation of a law per se. I think it was incredibly uncaring of them to do something like that. But I don't know that.
The police would not be responsible if, let's say, they were closer, there was a sneeze. So if a situation should ever develop like that, the police have no responsibility to investigate that?
Well, I think this is probably going to become more of an issue down the road. That was an issue during the HIV epidemic. There were cases of people who said, I'm going to give you HIV. I know I've got it. And they'd attack someone, some guy like bit somebody or he raped somebody or whatever the story was. There was definitely a number of instances in the HIV epidemic era. So I don't know that we have any of those cases yet. There's probably some of them out there. So that would probably be something that we need to pay attention to see what's going on. Hopefully there's not too much of that, that people will just be considerate and think of the common good, but there's always going to be some outliers.
Mm-hmm. Okay, thank you.
And if I could point out too, Marshall pointed out that masks are not mandatory. They're recommended, they're suggested. There are some food service locations where they're requiring them, but you can still go to the grocery store today and find customers not wearing a mask. There's no violation because they're not wearing a mask. Oftentimes, I think we also, and that's another conversation because I'm banging up against my hour, but the question is, why are we wearing masks? And I think there are two reasons. One is depending on your role. Are you a healthcare provider or are you a regular citizen? So there's some questions there. But ladies and gentlemen, we're coming up to the end of the hour, and I know most of you are so polite you won't leave, even though I promised you not to keep you beyond an hour, and you're hanging on. So what I want to do is read my closing here. Oh yeah, and our regular sign hanger is on the screen if you can see her. Wishing everyone a happy Earth Day. Thank you, Pat. But I want to remind everyone that the U.S. Census Bureau has kicked off the 2020 census. So now, while you're at home, is the perfect time to complete your census for your household. Really, it only takes about 10 minutes. I did mine the day I received it, and it took less than 10 minutes. You can respond today either online or by phone, all without having to meet with a census taker. So that's perfect. Next week, we're going to discuss, besides the medical information with Dr. Schillinger, we'll also be discussing some of the negative side effects of this crisis, namely domestic abuse and violence. Joining us for that discussion will be Patrice Schroeder with the 211 helpline, along with two awesome league members, Betsy Pickup and Kristen Murtaugh, and we'll have a great discussion for you next week. Based on my request last week, I've received a lot of feedback, a lot of ideas for future discussions. Thank you. Please keep them coming. If you have some ideas or things you'd like to hear, bring them on. I'd like to thank you again for joining us this evening, and thank you, Brent and Harold, for your insightful information. Ladies and gentlemen, please join us every Wednesday at 6 p.m. as we travel this journey through the challenges of this crisis together. None of us know what's in store for us. We're talking about some bizarre situations 3 months ago, 4 months ago. We never have thought about, we need to call the police because someone's talking to you and didn't have a mask on.
Right.
This is an interesting journey that we're on, but we're going to travel this together and we're going to come out on the other side better than ever. I'm Ken Thomas, and on behalf of the League of Women Voters and our Healthcare Committee, thank you and have a good evening.
Thank you for doing this, Ken. Good job.
Thank you.
Thank you.
Thank you.
Thank you.
Good night.
Hey,
Yes, thank you so much. I appreciate it.
Thank you.
thank you very much.
You're welcome. You all have a good evening now. Bye-bye.
Thank you, Ken. Good job.
Bye. Thank you.